Welcome to our online YouTube WebEx on adult learning. Please remember that you get credit for attending this WebEx, so pay attention and take note of the attendance code on the final slide of this presentation. Thank you for taking the time to continue your instructor education and to increase the diverse knowledge that you already have as a PHSS instructor.
Principles of adult learning. It's true that when we think about learners, we think about students, and when we think about students, we think about our youth, then adults at college age, and later people seeking degrees on into their 20s and so forth. In truth, adults maintain their ability to learn from the time they become a legal adult at 18 on into their golden years, into their 90s and beyond. If you're alive, you can still learn. As learners age, changes occur physiologically and mentally, and it'll help us to be aware of these changes in order to help our participants have the best learning experience possible. Learning keeps us young. It's a workout for the brain. We work our muscles to keep from losing muscle mass, and we should do the same with our brains. Just as adults lose a possible 3% muscle mass per decade, adults will experience a gradual decline in physical sensory capabilities. As instructors, knowing these facts will help us better enable people of all ages to get the most out of the courses that we teach. We can compensate by being careful that more senior adults sit where they can easily see and hear the class material. Check to make sure your participants are comfortable with both audio levels and the visual presentation before you begin your class. And remember to allow for the fact that adults are a widely diversified group with widely differing preferences, needs, backgrounds, and skills. Adults value sharing their life experiences, which can potentially be a valuable reference in any classroom when properly managed. Ask, has anyone saved a life, used CPR? Has anyone used their first aid skills? As an instructor, you can tie the lessons that you are sharing back to the adult learner's own life experiences to help them relate and retain the knowledge. Participants can gain independence and confidence through practice and repetition. Hands-on learning enables them to know they know how to respond appropriately in emergencies. Most adults' orientation to learning tends to center around their own life events and how it applies to them. Adults are motivated to keep learning by a wide variety of factors, and some examples could be taking a new direction after retirement, furthering education to increase income or seeking a degree, or pursuing interests that have gone unexplored. Active participation facilitates and contributes to adult learning. Red Cross classes are designed to give participants adequate time to process skills with a hands-on experience. Make your classroom a non-threatening, comfortable, and supportive environment. This will enable all of us to better learn life-saving skills.
Let's keep it positive. Remember how we are taught to give feedback, positive and corrective. So even when we are correcting an incorrect fact or a wrong action, we can frame it with something positive. Focus on correcting the skill, not the participant. After you correct the mechanics of a skill, go back and praise their performance. Let them know when it is correct and compliment their work. Let's talk about how to succeed. Remember, with a possible decline in physical and sensory capabilities, you may need to allow more time for senior adults to achieve understanding or to master physical skills. So allow extra time to master skills and also to comprehend and achieve skill objectives. Recheck that you have made it easy to both see and to hear both the lecturer, yourself, and the presentation. It may require a little extra volume or, again, a seat reserved closer to the action.
Make sure that your participants leave with the confidence that they would know how to save a life and the steps it takes to set that in motion. In essence, how to respond. Remember, whether their physical skills meet the objective or not, you can still make sure that a person knows how to respond. And with some flexibility on our part as instructors, maybe some extra practice time and coaching, Usually our adult participants will be able to find a way to meet the objectives and achieve that certification.
Remember your American Red Cross PHSS criteria for course completion and successful certification. Communicate those objectives clearly. Make sure you are heard and understood. Be flexible about the standard if need be, but never certify someone until or unless they meet all of the criteria and meet the objective. Remember, in our layperson workplace course, we require the end-of-course scenarios and no longer the written test. But know that when there is a written test required, participants must pass it with 80%.
Please check out all of the other WebExes in our series of YouTube videos. Learn some new facts and techniques or gain a new perspective on something that you already know well. Notice that your attendance code for this WebEx is sneezes. Get all of your attendance codes and send them to your training specialist for credit for attending these courses. Have a great day. See you on the next course.